Welcome to W10 Video Tutorials. In this video, we would like to introduce 5D NT features. NT, knuckle translucency, and IT, intracranial translucency, the measurement of the fluid within the fourth ventricle, are fetal measurements taken to aid in the diagnosis of the first trimester abnormalities. Both the NT and IT thickness are measured between 11 to 13 weeks, 6 days gestational age, or crown rump length CRL between 45 to 84 millimeters. The fetus should be in the neutral position. The fetal head should be in line with the spine, not hyperflexed nor hyperextended. Ideally, only the fetal head and upper thorax should be included. There are several ways users may place the calipers for NT measurements: on the echogenic line, in the translucency, on the maximum brightest echo, etc. Therefore, follow local policy or regulations on caliper placement. The intracranial translucency IT is actually the fourth cerebral ventricle seen as an anechoic area behind the brainstem in the mid-sagittal plane of the fetal face. The absence or occlusion of the IT may indicate a collapsed fourth ventricle caused by neurological abnormalities. Normal IT thickness values should increase from 1.5 mm at a CRL of 45 mm to 2.5 mm at a CRL of 84 mm. The first trimester knuckle translucency NT measurement is a part of an established screening program that demands accurate measurement on a well-defined and reproducible image. The standards for measuring NT, delineation of a good fetal sagittal section, proper placement of caliper, and measurement at the maximum distance of NT are difficult to perform without proper training and thus often operator dependent. The Herman score criteria recommended regular reviews audits be instituted to aid in the reproducibility of NT image quality. 5D NT addresses the following Herman score criteria: fetal section, 2 points; caliper placement, 2 points; skin line, 2 points; image size, 1 point; and amnion, 1 point, thereby helping the user secure 8 points out of 9 possible points. 5D NT automatically finds the mid-sagittal plane MSP within a volume dataset to help measure the knuckle translucency or intracranial translucency. Volume NT and IT decreases variability between users, experienced and inexperienced. It may also reduce the number of erroneous risk calculations by inexperienced sonographers. It helps to avoid the inter- and intra-operator variability that comes when performing these measurements manually. Using volume NT and IT enable more accurate and interactive detection of the mid-sagittal plane. Also, it provides an alternative opinion when the fetus is in a difficult position. To use the 5D NT feature, select the convex volume transducer and select the NT on an OB preset. To acquire a volume dataset, first optimize the 2D image. You can set appropriate values for acquisition mode and the distance before scanning. Set the location and size of the ROI both by using the trackball key and change button as desired. Next, press the 5D button on the control panel to enter the 5D Ready menu and select NT button on the touch panel. Press the Set key to acquire a 3D volume dataset of the fetus in a sagittal plane. Tip: for best result using the 5D NT feature, 1. Image the fetus in as close as possible to the mid-sagittal plane. 2. Use higher contrast settings during volume dataset acquisition, e.g., increase the 2G gray map number, decrease the dynamic range, and 3. Try to keep the transducer angle no more than 30 degrees beyond the mid-sagittal plane on the fetus. Once the volume NT or IT feature is activated, the volume will be displayed in three planes. A plane being the largest on the right side of the display, the B plane in the upper left side, and the C plane displayed in the lower left side. Blue lines will be demonstrated in the B and C planes, indicating the exact location of slice displayed in the A plane. From the fetal sagittal plane, use the trackball to place the seed point in the thalamus. The system is now ready to automatically align the volume dataset to display the fetus in the mid-sagittal planes MSP based on the thalamus location data. If the mid-sagittal plane is not suitable, you can reselect the thalamus's position. From the A, B, C plane screen, click the Change key on the control panel. Select Auto MSP on the touchscreen and use the trackball to point the thalamus location. After selecting the Set key, the re-rendered mid-sagittal plane will be displayed. During the process of aligning the volume dataset to best display the mid-sagittal plane, the system will also automatically zoom the image. After the zoomed mid-sagittal image is displayed, use the trackball to position the NT or IT ROI box at the desired border and select the Set button. Next, use the trackball to place the NT or IT ROI box to the opposite border of the area to be measured, and select the Set button again to initiate the automatic volume NT or volume IT measurement. The distance between the green dotted lines, ROI, can be adjusted using the ROI height button on the touchscreen. The marker size can also be adjusted, small, medium, or large, using the button on the touchscreen to allow for more precise measurements. When using the volume NT feature, the knuckle translucency NT calipers can be placed on-to-on, onto max brightness, or in-to-in. On-to-on automatically measures the NT by positioning the cursor on the NT's echogenic line. On-to max brightness automatically measures the NT by positioning one side of the cursor on the NT's echogenic line in the near field and on the brightest portion of the NT's echogenic line in the far field. In-to-in automatically measures the NT by positioning the cursor on the inside edges of NT's echogenic line. In order for the measurements to be added, select Assign to Report on the touchscreen. The 5D NT feature also can render the displayed volume NT and IT dataset using realistic view to allow a more intuitive confirmation of the measurement. Thank you for visiting our W10 video tutorials. Please visit again for more information on using your W10 ultrasound system.